morning. This video is for activating our core, or what we call in the clinic more technically the transverse abdominis, multifidi, pelvic floor, which make up your inner unit or your deep lumbar stabilizing muscles. So this video is really the foundational piece to what I consider my low back basics. If you've got a back injury, what do you do? And the first thing we're going to cover is activation of the transverse abdominis, activation of the pelvic floor, and holding these contractions for some time while you're breathing, because that in and of itself can be quite a challenge for some of my patients. And then we're going to move into some very simple mat-based exercises that do not require any equipment. We'll follow up with some videos that do require equipment like a foam roller. But for today, this one is just to set the groundwork and get everybody on the same page. This is also a good reminder for what does it mean to activate your core. You hear this term all this time, but you never really have it fully defined. And so I'm going to give you my definition and what I look for with my patients. And we start with finding what I call a neutral spine or neutral pelvis. So I see a lot of people that come in and they like to sit like that, which is what we call a flexed spine. So we need to find a position where we can sit more upright. You can see that if I adjust my pelvis, it can take me from this flexed position of my spine, or a kyphosis, excessive kyphosis, and we can kind of change this into a more neutral territory. You can also correct in the opposite direction and overcorrect and become a little bit too extended in the spine. We're looking to find this optimal placement of the pelvic bowl so that it rests in a neutral space and the rest of your spine just kind of hits its natural curves on its own. So what I like to do is you take your fingers and you make a little triangle here. So right at your bird's eye view, you can see where your thumb and index fingers are. So if you're kind of flexed, you'll see that you see a lot of your fingers. But if you start to roll your pelvis forward into what we call an anterior pelvic tilt, you'll see your thumbs stack right on top of those index and middle fingers, and that you create this stacked triangle. What you'll also notice is you're sitting on your sit bones or your ischial tuberosities. So these sitting bones, they serve as a nice feedback mechanism for if you're sitting in a neutral position or you're not. Because if you roll too far forward, you kind of roll in front of the ischial tuberosities, and if you rock back too much, you'll feel you just go onto these bony prominences and then just kind of fall off of them. You want to balance right on top of those bony prominences called the ischial tuberosities, and then from there you have a neutral pelvis. That's going to set your spine up. Now, some of us have flatter spines than others, so we're not going to look for perfection. Rather, we're just looking for a better zone of alignment to keep our body in a more optimal space. So how do we keep this without having to prop ourselves up with our arms all day, right? Or use these big erector spinae muscles in the back. How we do this is from connecting to a muscle that works very much like a corset, and the muscle fibers go horizontal this way. So what you'll do is you'll pull your rib points here where your ribs kind of stick out. These are not your floating ribs, okay, people? Your floating ribs are back here. Please don't call these your floating ribs. These are called your false ribs. You want to pull them towards each other as best as you can so that you can't stick your fingers through. Then you've got your hip points down here, your ASIS. You want to think of pulling those energetically towards each other as well. And then the lower belly pulls towards the sacrum, the belly button pulls towards the spine, and the front ribs pull to the back ribs. You should feel a nice big core sitting action happening there. Good release, let it go. Find that neutral space, and then we hold it again, and this time we're gonna go for a pelvic floor contraction. So the pelvic floor is on the bottom of your pelvis. It is where things exit out. So for my ladies in the room, I usually say this is the muscle that stops the flow of urine. It also can hold your gas in. For my gentlemen watching the video, I want you to visualize you're sitting on a block of ice and you're lifting the boys up away from that block of ice. And you're looking for that space between the scrotum and your anus and that whole space there, and you want to think of that space lifting up and away. Okay, so men can also use the cue of holding gas in, holding the flow of urine in. All of these cues work well. This is also called a Kegel contraction. Maybe some of you have heard that. And in yoga, we've also heard this referred to as Mula Bandha. So what I want everyone to do right now is find that balance point on your ischial tuberosities. Then I want you to feel that you're kind of stopping the flow of urine and contracting that space. And what you should feel is that the ischial tuberosities might want to pull towards each other energetically. And that the pubic bone in the front and the tailbone in the back, they're going to pull towards each other energetically as well. So these four corners are going to pull in. And how do we know if we're doing this contraction right? Well, there's a few ways we can check. So relax everything, set your pelvis back in neutral, and then take your fingers and walk them in 2 inches from your hip bones and poke your belly. From here, contract your pelvic floor, and what you should feel is that the muscles under your fingers tighten up and maybe push your fingers out a little bit. So once you feel that, you kind of go, oh, well, look at that. You can kind of feel this connection that the pelvic floor feeds into contracting the lower fibers of your transverse abdominis. So that is the hip points pulling towards each other cue. Excuse me. So you want to feel that these are pulling in, the pelvic floor is contracting, the rib points are now pulling in towards each other, ribs, front of the ribs go to the back of the ribs, belly button towards the spine, lower belly towards the sacrum. Everything should feel very engaged. Maybe it's even hard to breathe here. And if you're having difficulty breathing because you're squeezing so hard, congratulations, you're getting the contraction I want. Now we just need to know how to work within that contraction. So squeeze everything as hard as you can and hold. And now what I want everybody to realize that this is a full engagement of your core. Do we need this full engagement all the time? No, we do not. This is for when we're about to do something pretty vigorous, okay? So now that we've got a full engagement, I want you to back it off 50%. And all of a sudden you feel like, oh, there's still tone there, but there's not a lot of effort where it's exhausting. Okay, now we've got a little tone. See if you can soften it just a little bit more. And we're aiming for like 30-40% engagement here. And this is going to give us what I call tone. So when I say tone your belly, it means exactly this contraction. So we're not squeezing everything down super hard. We're backing off and backing off a little bit more, and we keep a little tone there. Once we have that, we've kind of now defined engage your belly. So engage your belly means this, or tone your belly means this level of contraction. Ready? Everyone release. Okay, so now we're gonna hold this contraction for some time. Contract your belly, contract your pelvic floor, and use tone. Don't use a full engagement. And we're gonna rest our hands on our ribs here. When you take an inhale, see if you can keep the tone in your belly and pelvic floor in the position of your pelvis as you let the ribs expand up into your hands from the sides. Exhale the air out. Inhale. And exhale. Inhale. And exhale. Two more breaths. Inhale. And exhale. Last one, inhale. And exhale. Release. Okay, so now we're going to go on our backs. So this is called a hook lying position. You can see from your angle that it creates a hook shape. That's where it gets its name from. From here, I want you to put tone in your belly and your pelvic floor. You'll take your arms and reach your hands away from your shoulders towards your feet. So that way you feel your shoulder blades slide down away from your ears. Keeping your belly tight, you're going to lift one leg up into tabletop and then slowly bring your other leg up to meet it. So we're building the table, then we're breaking it down. Right leg, then your left leg. Please keep pace with me and don't go fast. The other thing is don't let your back arch. You want to keep your back relatively flat against the mat. And to do that, you need to keep using your belly. Left leg floats up now, then your right. Take your left leg down, then your right leg. Float your right leg up, then your left leg. To help you with feedback, you can keep poking your fingers in your belly, and you shouldn't be able to get through. You should feel some type of muscular armor underneath there. Now, the joke I always get is, well, Paul, I've got a lot of soft tissue here. You can't feel the armor. And I'm going to tell you, that armor's there regardless of how much soft tissue we have above it. We all have some soft tissue above it, okay? We all do. Be kind to yourself and find that contraction. That's all I ask, okay? Do the best that you can. Now let's say this is really hard and you can't bring that other leg up without arching your back or feeling some kind of pain. Your modification while we keep doing these tabletop exercises is that you're just going to lift one leg up and then slowly bring it down. Then you bring the other side up and slowly bring it down. Okay, so you work on that if that's all you can do today. And then when you do this video again, you try, hey, can I lift that other leg up without arching my low back? Oh my gosh, I can, that's amazing. That means you're getting stronger. And we celebrate that. We celebrate every victory we can right now. Go, left leg comes down, then your right. One more on each side, take your right leg up, then your left. Right leg down, then your left. Left leg up, then your right. Left leg down, and then your right. Take a break. Okay, next exercise we're going to do. There are two variations of the dead bug I'm going to show today. The first one is going to be an isometric. So what you'll do is belly tight, pelvic floor tight, lift your left leg up, take your opposite hand, your right hand, and you're going to push it into your left knee. You should feel that. Do an isometric, asymmetrical type of contraction in your belly. Try to hold on to that as best as you can as you lower both your arm and leg down. Then your left leg comes up, right arm. And switch. Right arm, left leg. Take it down. Left arm, right leg. And they give it a little push. So the cue I give here is that you're trying to like squash a little ant on your leg that's crawling there. I know I'm gonna make some people angry by saying that, but it's you could substitute that with you're just squashing something on your leg, and maybe it's not an insect, maybe it's a little berry or something. The idea though is that you're squashing something. And swap your legs. The whole time you're still trying to keep that back relatively flat on the floor. You're not letting it arch. If you're getting some kind of pain in your hip or low back, maybe you don't push as hard into the isometric. Okay, now we're going to do the opposite side. And then we're going to switch the dead bug. Now, left leg comes up, right arm goes overhead. Take your leg and arm down, switch sides. Take your arm and leg down, switch sides. What this is going to give you an opportunity to feel is how stiff you might be in certain parts of your body, how one side of your body might perform better than the other. We don't judge it, we just are making observations today. Oh, that's interesting. When I do my left leg and my right arm, that feels less connected. Okay, see if you can contract your belly a little bit more, and does that help the connection? And inhale as you lift. Exhale as you lower. Last side. And exhale, lower. So we're going to do a bridge now. So from a hook line position, walk your feet back a little bit. This one, again, we're doing stuff without any equipment in this video because some people at home may not have equipment. So you'll reach with your arms down, press your arms back into the mat, tighten your belly and your pelvic floor. Begin to lift your pelvis up. This is a bridge. This is what it looks like. For some of you, this may make your back pain feel a lot better. For some of you, this might cause more back pain. So let me give you the variations first. If this feels good, keep doing what I just mentioned to you. If this hurts, you're going to practice tucking your butt under a little bit more, and maybe you just lift up a little bit. Keep that belly tight and then lower back down. Try a few of those, tucking under, lifting up a little bit, and then back down. If that still hurts, then you're just going to work on just a little bit of a tuck and release. Tuck and release. For everybody else, keep your belly tight, lift your hips straight up, and then back down. Belly tight, pelvic floor in, lift up, pull your heels isometrically towards your butt, get your hamstrings to fire with your glutes, reach your knees out towards the wall in front of you, lower down. Notice I'm coming down with a flat back, so I'm lifting straight up, move my arms, and then I'm just sitting my butt straight back. I'm not doing an articulated bridge, that's more advanced. Right now, we're under the assumption you might have some back pain. So this type of bridge is what we call a neutral bridge. You're just going straight up and straight down. So think, lift your hips straight up. Take your hands at the crease of your hips and then fold over your hands. Drop your butt straight down and back. Be mindful that if anything hurts, and you've tried the modifications I've given, then if it still hurts, then don't do it, skip this exercise. Just wait till the next one. Release. We've got 2 more. And 1 more. Modified side plank. This is to help tackle the side body, which usually during back injury can be ignored and can get weak, and maybe this is where the weakest part of your body is or weakest link is. So we start not with our legs straight, but because this is a beginner video, and for those with back injury, we keep the knees bent. My knees and my hips and my shoulders are in one line. My elbow is relatively under the shoulder on the side I'm starting on. I'm starting on my left. It's gonna look like I'm starting on my right on this video. You'll press your arm down into the mat, belly tight, pelvic floor tight, and lift up into a side plank. Now, if that's hard for some of you, you'll take your other arm forward and assist yourself this way. Okay, so come up. And we're gonna just hold for 5 breaths here. Inhale and exhale. If you want to take your other arm up, you can. And exhale. We have 2 more breaths here. Inhale and exhale. Last breath, inhale and exhale, come down. Let's switch to the other side. So you'll bend your knees, you'll rest on your forearms, take your elbow out just a little bit from your shoulder, take your hips forward, knees, hips, and shoulder in one line. Take your belly, pull it in, keep it tight, and lift up. You can check your belly here with your other hand. Once you know you've got your belly tight, lift your arms up. And if you have a neck issue here, you just take your gaze down. So breathe in and breathe out. Inhale, exhale. Inhale, exhale. Last one, inhale and exhale, come on down. Bird dog variation. This is to get to muscles on the back side of your body. So this is not a neutral spine position, neither is this. We kind of want to go in between. So if you can do this in front of a mirror and you can kind of go both directions and see where that in between is, then you want to hold that space with your belly. You'll reach your left arm forward and your right leg back. Careful here, because this is where people like to rotate their hips. So you want to think of pulling your hip bone towards your belly button. That'll really straighten out your spine. Then switch. Right arm forward, left leg back. Again, pulling your hip bone this side towards your belly button energetically, so we're not letting it rotate out. And switch. Left arm, right leg. And switch. Notice we're not in a hurry. We're just exploring what does it feel like to keep your balance here. Some of you will feel one side is more difficult than the other. We're switching. Good. Right arm, left leg. Left arm, right leg. Right arm, left leg. Left arm, right leg. Right arm, left leg. Last one. Left arm, right leg. Right arm, left leg. And release. Thank you for joining me in my low back basics. This is the introduction into low back pain relief, getting a little bit more strength and control in your lumbar spine. This is gentle and easy to do. And if you're feeling a little achy in your back, you can always go back to this routine. Feel free to rewind it and play it again from the point that we start doing the exercises after we've done the facilitation work. If you have any questions or comments, you can put them in the comment section of my YouTube channel. I'm also taking requests for other videos. We will be producing as much content as we can in the next coming days. I wish you all good health and thank you so much for joining